Hi guys, welcome to Maritime Business Veterinary Technician Review course. We're going to start obviously with 1.1, which is Introduction into the Profession, basically reviewing our office procedures module that we did here on campus. So let's get started. Okay, so the purposes of medical records within a veterinary hospital is very important. The primary purpose for these medical records is to support excellent medical care, documents, procedures, and communications with the client and in the hospital as well. Very, very important for even just one technician to know what the other technician was doing. The secondary purpose would be support business activities and supports legal activities and supports research. So a lot of the times, all the time it becomes a legal document and it is owned by the clinic. And if ever there is a legal reason why we need to refer to these medical records, it needs to be clear and concise. Veterinary client-patient relationship. Let's talk about that. So the acronym for this is VCPR, and this is the fundamental relationship between the vet, the client, and the patient. And it exists when the veterinarian takes responsibility for clinical judgment and client agrees to comply. The veterinarian is personally familiar with the keeping and care of the animal, and the veterinarian is readily available or has arranged for emergency care and follow-up in cases of adverse reaction and treatment failures. So basically, the VCPR is the veterinarian has a relationship with the client, and then as well has a relationship with the patient. So it's very crucial for legal reasons and for quality care so that the veterinarian has a relationship with both of them before he continues on with any kind of medical care. So informed consent. So the client should be educated in the following before treatment. Any kind of illness or diagnosis or prognosis, it's very important that the client understands exactly what's going on, exactly what we're going to do for testing, and what the diagnosis means. They need to understand their options. It can't just be one. Most of the time, there are several options, and they need to be aware of all of them. Also, what to do to follow up with this situation, and in case of emergencies, what to do. Some clinics have an alliance with a emergency clinic that's open during off hours, and then there are some clinics as well that are open 24/7 and deal with their own emergencies, or if not open 24/7, then are on call if ever an emergency arises. So they also need to understand the cost of everything that they're choosing to do and exactly where those costs come from. So it's important to document the informed consent. So there's going to be authorization forms for everything. Every time a patient is hospitalized, it's very crucial that a consent form gets signed so that we have legal rights to continue on with the care. And the person signing that authorization form has to be an adult, a legal adult, so they have to be 18 years or older. And very important also to have fee and estimation forms so that there's no surprises for the client when it comes to So the owner's written permission must be obtained before proceeding with the diagnostic or surgical procedures. We can't continue on with a procedure without having that consent form signed by the owner. If ever they are in hospital and we need to do something that we weren't given consent for, it's very important to then follow up with the owner and receive consent for that procedure before we continue on with it. The procedure's risks and predicted outcome must be explained. The form must be read in its entirety before signing, and these forms are part of their medical record, therefore become a legal document. So documentation protects against litigation and complaints. So it's very important to write it down in black ink or type it electronically. A lot of clinics and hospitals now are going paper-free, so everything is documented electronically. But if ever there is a place or any kind of form that requires you to handwrite, it's very important to write in black ink. Never, ever, ever use red pen. The whole entire document will be dismissible in court. So I always go around the clinic and always throw away all the red pens just to avoid that complication. But it's very important to write everything in black or blue pen. Sign all documents, including credentials, dates, and times e-file entries as well. So it's very important that when you do mark down something that you have done with the patient, to make sure that you put your initials, RVT, the date, and the time that it was done. And this will just ensure quality care. It's important to write legibly. Everybody knows that doctors have terrible handwritings, so it's up to the technician to make up for that and make sure that you write neatly and legibly. Again, with electronic-based medical records, that seems to be taking care of that problem, but nonetheless, if ever there's a written document, just make sure that everybody can read it. Tampering or inaccuracies cast doubt on the integrity of the entire record. So if ever there is a mistake when you write, just put a line right through it. Don't scribble it out because it still needs to be legible underneath that line. And make sure that you put your initial and the date on it. So it's important to never use whiteout. Again, it'll be dismissible in court, so no whiteout, no red pens. If you make a mistake, cross it out with a line and initial it and date it and write error just to be sure that it doesn't cast any doubt. So as far as the medical records go, it is a legal document and it is owned by the practice, not the client. So there are some cases where clients may demand to have their medical records and take it, and it's legally not okay for them to do that. So they may request a copy, absolutely. And that's pretty much it. Signed authorization forms from client must be obtained before sharing medical records with a third party. So if ever there is a clinic or any kind of third party that's requesting these documents, we must have signed authorization from the client to release this information. A lot of some examples of when this would happen is if a client is adopting a new pet from, let's say, the SPCA, and the SPCA gives us a shout and says, listen, we'd like to know some information on this client of yours and what kind of a pet owner they are. We're unable to give them any kind of information unless that owner has signed authorization allowing us to divulge this information to that party. So that's very important. There are exceptions, of course. Reportable diseases, it's law that we have to report this, and we do not need consent from the client. For example, if a patient is diagnosed with rabies, that is a reportable disease that puts the whole community at risk, and so we don't need consent for that. If it's a court order, if something was subpoenaed, animal has bitten and proof of vaccines is required, and health insurance companies as well, those are all exceptions that we don't need the client's authorization to share that information. Medical data. Original records must be maintained by the hospital for a specified period of time. In Nova Scotia, this is currently 7 years. So a lot of places, they don't want to have to keep 7 years worth of files active out where we use it every day. So oftentimes after 4 years, we'll sift through the files and see if they haven't been attending the hospital and it's been about 4 years, we'll make an inactive file. Okay, so all these files are placed in a different location and they're considered inactive. But by law, we have to keep these records for a total of 7 years. So although we make them inactive after 4 years, we have to keep them for a total of 7. And then after that, they have to be shredded. So, yeah. Confidentiality. All information on every record is absolutely confidential. As we discussed a few slides ago, we talked about informed consent. No one can get information from this record unless we have consent from the owner. It's very important that your client's privacy is protected and respected. The contents of the record must never be divulged without the owner's consent, as we said before. And after 7 years, the file is going to be destroyed, but the confidentiality still must be maintained, so you have to shred it. So let's talk about hospitalized patients. So record keeping with these guys is very important, and a technique that a lot of people use, doctors and technicians, is something called SOAP, notes, okay? So not everybody uses this technique, but it's very important for you to be familiar with it. If ever you're dealing with a medical record and the doctor uses this method, you have to comply with that. So SOAP stands for Subjective, Objective, Assessment, and Plan. So basically, subjective information is usually performed by the vet tech or sometimes by a veterinary assistant. And this is basically how the patient appears from casual observation. So this is without taking a temperature or touching the patient, it's just how they look when they're walking around the waiting room or the exam room. And this is the subjective information that you're going to be putting under the S of SOAP. Now for objective information, again, this is usually performed by a veterinary technician, and it's a physiologic data, for example, TPR, so temperature, pulse, and respiration, vomitus, defecation, urination, any of these kind of issues that are happening with that patient is going to be documented under the O. Any lab data, notes from the surgical site itself, if it's a postoperative check, catheter placement, swelling, anything like that. So usually the objective is a hands-on kind of documentation or something that the information that the owner gives you about his urination and defecation and all that good stuff. So that goes under the O. After that, the A and the P is usually done by the veterinarian. So preliminary assessments would be the S and the O, done by a veterinary technician or a vet assistant, depending on how the clinic runs. And then the assessment and the plan is done by the veterinarian. So the assessment part of it determines the overall status of the patient and tentative diagnosis is developed. Again, veterinary technicians are not able to diagnose, hence why this A part is done by a veterinarian. So this is where they're going to start coming up with ideas of what's going on. And then the P part of it is the plan. Okay, so this is the course of action. This is what we're going to do. We're going to do this blood test, this x-ray, this treatment. And again, that's all done by the veterinarian. So a lot of veterinarians use this technique, the SOAP technique. So if ever you see the SOAP, you'll know exactly what to do and where to put your information. So when we talk about signalment, this is an important aspect of medical records, and it refers to the collective information that identifies an individual patient. So specifically, the species of the animal, their breed, their gender, reproductive status, age, color, and distinctive marks. So these aren't debatable topics. You can't debate these things. So the species, is it a dog or a cat? Breed, is it a boxer? Is it a Shih Tzu? Gender, is it a male or a female? Reproductive status, are they spayed? Are they intact? Their age and their color and distinctive markings. These are all signalments of the patient. Very important for medical records. So another type of records that's done in hospital are logs. Now there is a log for everything and there's a reason for it. It's basically to cover your butt. So anything that's done in radiology needs to be logged. Anything that's done in the lab needs to be logged. Anything with anesthesia needs to be logged. Surgery, for example, these are all things that need to be logged. So they're continuously updated data. This continuously updated data serves for two purposes. So basically documentation for legal support, as well as data for quick analysis and retrospective. So if we do need to search up the results, for example, of a certain patient, we can go back in the log and quickly find those. Different categories, like I said, it can be departmental. For example, anesthesia, surgery, radiology, all narcotics must be logged, laboratory, euthanasias. These are all logs in every department that need to be maintained. It also drug reactions have to be logged, unexpected deaths, medical waste logs, and controlled substances log are all very important within a vet clinic. So inventory. Inventory within a veterinary clinic is going to keep track of pharmaceuticals, of vaccines, pet food, surgical supplies, and laboratory reagents and test kits. So this inventory is just going to basically aid you in not running out, because how terrible is it when it's a really busy day, a client comes in and requires this test, and it could very well be a life or death situation. And you know what? We go to grab the test and it's just all out and no one caught that. So inventory is so crucial to make sure that this doesn't happen. And with inventory, it can be tricky because there's this balancing act between too much and too little. So if, for example, let's talk about veterinary diets, we can have too much and then all of a sudden bags are expiring. Those are very expensive. So that waste is a huge loss for the clinic. And too little, again, we don't want that client coming in and not being able to have it because we just accidentally ran out. So it's a very delicate balancing act, but very, very important. To help with this balancing act, you can do a weekly shelf count and make sure that you have the right amount of food, and check invoices against items received and paid for to make sure that everything is in order. So again, continuing on with inventory, only maintain the smallest quantities of drugs and supply that the clinic need. Again, this will help avoid the waste. That will be a huge financial loss. To ensure accurate inventory records, control theft, and keep other shrinkage to a minimum. And other shrinkage would be, for example, a technician grabbing a bag of treats and leaving it open for everyone in the clinic to use. We have to just be careful with that kind of stuff. Accurate inventory records must be readily available, and the system must be user-friendly so all can use it. Generally, one person is in charge of the inventory, but everyone should have access to it and be familiar with the system. So inventory control, continuing on with that, vendors' numbers are kept to a minimum. So a lot of the times, I don't know about every clinic, but a lot of clinics in the HRM, and I don't know about across Canada, but here in the Halifax area, we tend to use CDMV. So there's a whole bunch of other reputable vendors. For example, these pictures shown at the bottom here, but CDMV tends to be the most common around these areas anyways. And they're interested in the success of our clinic, and they provide needed products, and we get good service, and they're fair prices. Delivery is very prompt, so we can order things from CDMV, and within a day, it's at our door. So we need to make sure that there's a reasonable profit that's made on these sales. And very important, going back to shelving and inventory and having things expire, that when we do receive these new products from CDMV, that we rotate the products on the shelves so that the older products are in the front and the newer products that were just received are behind those older products, and that will help avoid things expiring. Yeah. So communication, let's talk about communication within the veterinary hospital. It's the desire to transmit a message and have someone receive and understand the message in the context in which it was meant. So this could be communication with staff members, or it could be communication with the client. Either way, it's crucial. So there's two types of communication. There's interpersonal communication and clients and staff communication. So the components of a good communication, it's very important to be clear. So clarity, you have to be clear in your speech, use good grammar, and articulate. There is nothing worse than getting some kind of customer service where someone is mumbling and you have no idea what they're talking about. Important to be courteous and respectful at all times. Avoid words that may offend. For example, curse words, religious words, slang. These are all things that may offend some people, and I've seen it happen a lot in veterinary hospitals, and it just makes me cringe when someone uses a curse word or some kind of religious word or slang. It's just inappropriate, and you have to, a lot of people wouldn't even care, but the ones that do, we have to be careful, and we can't offend those people, okay? Positive nonverbal communication. So it's very important to be aware of your body language. A lot of the time, your body language speaks louder than the words that are actually coming out of your mouth. So it's important to make direct eye contact. Don't cross your arms. I know myself, dealing with customer service, it's very easy to tell if the person that's dealing with you is interested in what's going on, and you have to be compassionate in veterinary medicine, and you can't give off the vibe, the nonverbal communication, that you're not interested and that you're not present there with the client. It's important to do open-ended inquiries, so this will aid in receiving important information. We need to get that client to talk as much as possible. And by giving them open-ended questions, we can get that information. We'll talk a little bit more about that further down the slides here. Reflective listening, so let clients know you understand. So you have to basically, a client tells you information, and it's important that they understand that you're understanding them, right? You're right there with them. And again, we'll talk more about this reflective listening. Empathy, put yourself in their shoes. I think this is probably, one of the most important aspects of communication in a veterinary hospital is empathy. We deal with clients that are very emotional, and we deal with a lot of cases that are very sad and hard. And it's very important that we're empathetic and that we let the client know that we're right there with them. So let's talk a little bit more about nonverbal communication. So important. When it comes to your eyes, it's the most easily interpreted. So 1 raised eyebrow, 2 raised eyebrows, a wink, eye shifting, eye contact. So these are all going to tell the client how invested you are and how you feel about what's going on. So you should face the client and hold the gaze. Don't be looking around or trying to pay attention to something else and shifting, because it's just going to show that you're not interested and that you're not really fully there with the client. Your face is the most reliable, so a smile, a frown, a pout, or a sneer can tell a lot about how you're feeling. You need to be empathetic. A relaxed facial expression or match the expression of the person, very, very, very important. Your hands, a clenched fist, you can imagine what that would tell a client. Touching your face, rubbing your eyes. Very important that you're not fidgeting with your hands and that you have a relaxed stance. And again, continuing on with your arms across someone. When you're speaking with someone and they're right in front of you and they have their arms crossed, that's pretty much saying, listen, I'm not really interested. I'm not really here with you. So it's very important to not cross your arms, have them open, and it just shows that you're receptive. Posture, shuffling your feet, sitting on the edge of your seat, hunched or standing tall, head down, walking turned away. All of these types of postures are going to tell a lot about how invested you are with that client. You should keep your posture erect but not rigid, and stay about 1 arm's length away. I often see people communicate with clients and they're standing on the other side of the room or 2 seats away from them, and it just looks so disconnected. When you are going to sit down with a client, make sure that you're right beside them. Don't get too close because that could be awkward, but you just want to stay about 1 arm's length away, and that just shows that you're right there with them physically, and your legs crossed or how they're facing, these will all affect it. You should stand straight and have them gently crossed towards the person. Now, I'll tell you, I have seen some people, even though they are sitting about 1 arm's reach away from this person, they have their legs crossed away from the client. And man, that shows that you're not there with them. So it's very important to gently cross them towards the person. Your attire, you should wear professional scrubs. You have to look professional, obviously. You have to make sure that you're clean. Please don't walk around the clinic with bloody scrubs, or if you've got hair all over your scrubs, just take a lint roller and clean those up a little bit. It says a lot about your hygiene. And your tone as well. You have to speak in a moderate, clear tone of voice. You can't get upset or start yelling or screaming, or it's very important to maintain a good tone. So let's talk about closed-ended questions. So these are things that we shouldn't be doing, okay? So closed-ended questions do not generate a great deal of information, and they don't help to identify and solve a problem, okay? So for example, it invites a one-word answer, usually yes or no. For example, did you buy this at a pet store? And then that's a yes or no question. So this could be leading them to answer a certain way, the way that you ask it. Perhaps you would judge them if they bought it at a pet store. So they'll go, no, I didn't buy that at a pet store. No, I don't remember. And whereas if you had have just used an open-ended question like, where did you purchase the food? And so they have to think about it. You're not leading them to a certain answer. You're not expecting a certain answer. You're literally just asking, where did you get it? And then that'll encourage them to think and answer on their own. Another close-ended question would be, did you use the ear medication every day? So again, you're basically telling them you want them to say yes, and they may be embarrassed if they have to say no, so they may lie, or it's just not giving you the information that you need. So in that case, you would say, how often did you use the ear medication? And did you speak to the veterinarian? It's a yes or no. It's a yes or no answer. Again, who did you speak to about this? What was discussed? These are all things that you need to be careful and make sure that you use open-ended questions. So there's leading questions as well. Suggest to the client that you expect a certain answer. We kind of talked about this in the last slide. I suppose you're going to call the breeder now. Again, that's just assuming, and it's a leading question. Did you wash your hands? You washed your hands afterwards, right? And again, you're leading them to say yes, even if they did or not. You've had this dog for a long time, haven't you? So again, these are all leading questions. It all leads the owner to believe that there's one specific answer that you're looking for. Very common examples that you hear often in practice is no changes in urination or appetite. So that's leading them to say, oh, no, everything's good. Whereas if you had have just said, has there been any changes with anything, urination, eating, defecation, and then they're going to stop and go, let me think about that. Actually, you know what? There has been a change in the drinking. So you have to get them to think on their own without you leading them to actually answer the way that you want them to. So he's doing well, no concerns. And then obviously you're leading them to say, oh no, that's it. So these encourage the client to agree rather than to express their concerns or give important information. Open-ended questions. This is what we need to do, okay? So this requires the person being asked the question to give the matter some thought, okay? So how did that happen? Why? What, who, when, and where. So it makes them think about everything. So what brings you in today? So then they have to explain everything to you. And that's the way you get the most information. When did you first notice Fluffy's problem? So this makes them think, oh gosh, has it been a week? Has it been 2 weeks? Has it been a day? Let me think back to when I first noticed this. And how often did you use the medication? Then they can say, oh, well, every now and then, every second or third day, or you're not leading them to answer a certain way that you want them to. It encourages them to think and actually give an answer. And so these are all examples of open-ended question, and this is what we need to do to get the most information. So how can we listen better? It's very important to listen when it comes to client care. We don't want to make assumptions about what the speaker plans to say. We have to listen and really hear what they're going to say. We don't want to frame your answer while someone is still speaking, okay? Let them speak and then think about what your answer is going to be. Never fake listen. People can tell. You can tell when someone's not really listening to you. For example, if you've ever been talking to a friend and they're sitting there on their phone and you're telling them something that you feel is very important, how frustrating is that, right? And they're like, oh yeah, no, I'm listening, but you kind of can tell that they're not really fully invested in your conversation. So it's very important not to daydream or do anything or write while they're talking and all those kind of things, because that's just fake listening, and everybody knows when you're faking it. Never judge or criticize. This is very important. You know how easy it is to judge people. It's so easy, and it's easy to criticize. And this is a huge mistake done in veterinary medicine. There's been a lot of circumstances where inevitably some staff members will judge a book by its cover and say, oh, this client definitely is not going to be able to afford this. And you know what? A lot of the time, those are the people that'll go above and beyond and financially, no matter what it's going to cost, they'll go and above and beyond and make it happen. So it's very important to never ever judge and never criticize. You know, if a client decides to go a route that you wouldn't have taken, you can't criticize or judge them for that. It's their pet and they have their own feelings and morals and ethics, and you have to just respect that. And it's very important not to do that. Never interrupt or jump in or take over. Again, that's demeaning and you're not letting them speak. So we need to let them speak and we need to listen. It's very important what we do when listening. We have to look at the speaker. So again, don't be looking at your cell phone or the medical chart. You have to look at the speaker, and this is really going to this is going to show them, I'm listening. I'm right here with you. I'm looking at you. I hear what you're saying. Relate to the speaker's feelings. A lot of the time, especially with difficult clients or upset clients, it's very important to nod. That's a good way of agreeing with what they're saying, keeping a neutral face, and relate to what they're saying. So a lot of the time saying, oh, I totally understand what you're saying. I understand where you're coming from. I can only imagine how this feels. So again, it's just relating to what they're saying. And look for points of agreement. Even if you don't completely agree with what they're angry about or what they're saying, you have to say, I can understand how this would be frustrating, and look for points of agreement. Again, once a difficult client or a challenging client or an upset client, once they feel that you're there with them and that you agree with them and that you really want to help them figure this out, even if in your head you're thinking, this is crazy, once that angry client or upset client feels that you're agreeing with them and that you're there to help them, that's how you diffuse a bomb. That's how you calm them down. And by listening properly to these people, that's how you do that. Provide a brief summary of what you've heard. So again, that's just reiterating that you've heard what they've said, and reserve judgment until you have all the information. Even then, don't judge. Once you have all the information, they're going to make up their own decision, and we have to respect that.